Goeienaand, good evening, fellow South Africans and citizens of the world. And look, I'm going to just say coronavirus is out of control in South Africa, okay? Call it fake news, and I'm sure some people will, but it's not a prophecy, it's a fact. Look at Italy. Look at any country where the coronavirus has come in. 14 new cases of coronavirus identified earlier today in South Africa. That's only the ones that have been actually confirmed. 14, up to 38 confirmed cases of coronavirus right now. Now, what I'm going to read to you is the reason why I'm saying that the clusters are going to start happening in South Africa, like they've happened all around the world. Look at North Italy, absolute pandemonium over there because of coronavirus. That's a cluster. Consider the African townships. They're all going to be red-hot clusters of coronavirus. It's going to be devastating. And that's not some kind of a fear-mongering. I'm just stating the obvious. Just be aware of that. And when it happens, you'll say, yes, Scott was right. Now, I'm going to read you a letter that Jaco sent me as a shout-out to Jaco, because a couple of schools in South Africa have now closed because one of the students, in one case, has been found to have coronavirus. And in the other case, well, I'll just read to you what Jaco says. He says, I'm sure you're aware of Herzliya, which are in shutdown. That's the school where one of the students had the coronavirus. Stepping Stones Montessori School are also in shutdown now. It affects me directly also. Earlier on Saturday, the United Herzliya Schools in Cape Town sent parents a letter which stated that a grade 9 girl had tested positive for COVID-19 or coronavirus. Now, remember that before you show the symptoms, you are infectious. This girl's interacting with maybe 100 other girls in classrooms and stuff like that. There's a high chance that some of those girls will now have the coronavirus. You can see what I'm talking about when I say a cluster. And this is what the Stepping Stones Montessori School have written to the parents, including Jaco. This gives you a bit of context. Dear parents and staff, this is a follow-up from the communication this morning that a parent of 2 students at Stepping Stones notified us this morning, the 14th of March, that they have tested positive for COVID-19 after returning from a trip to Europe. After consultation with the parent's physician and the school trustees, the school will close with immediate effect until the 31st of March. We will reevaluate at the end of the month whether to stay closed longer. Now, what they're doing is the right thing, because some of the kids that got in close contact with the 2 kids, or the parent who's been infected, could well be carrying the coronavirus without even knowing it and could be infecting other children. Again, another cluster. This is why I say this disease is deadly and it's so infectious. Anyway, let's continue with the letter from the school. This decision was made given the evolution of COVID-19 globally and in South Africa, and our commitment to prioritize the health of the most vulnerable in our community. We must learn from the crisis situations in other countries and put measures in place to slow down the spread of the virus so a sudden large spike of infection doesn't overburden the healthcare system. What healthcare system? There is documentation that while unlikely, transmission can occur while asymptomatic. Well, it can very easily occur under those circumstances. Anyway, they say there is documentation that while unlikely, transmission can occur with asymptomatic carriers, and by practicing strict social distancing, we can slow and delay community transmission. In general, the risk of infection to children, parents and staff of Stepping Stones from the parent who tested positive for COVID-19 is minimal. While the parents were briefly on campus on Wednesday, We've been assured that casual contact, e.g. walking past, waving hello, is not cause for alarm and does not require you to self-quarantine. Those who have had close contact with the parents have been notified and instructed to self-quarantine for 14 days and monitor for symptoms. The children did not return to school after spending time with the parent. We have also been made aware that one student was in contact with the infected parent on Wednesday and went to school on Thursday and Friday. That student and family have also been told to self-quarantine. We have been assured that it is extremely unlikely they were contagious the days they were at school, even if they do eventually fall ill, but we will monitor it closely. NICD is in the processes of confirming the test results and will then proceed with the protocols, including contacting tracing. We are acting now out of extreme caution, understand that any further delay will cause further distress amongst families and staff and could unknowingly contribute to further community spread. Please call your primary health care provider if you or an immediate family member experience symptoms, fever of 38 degrees Celsius or higher, cough and or difficulty breathing, recently traveled countries with widespread or ongoing community spread, are close contacts of confirmed COVID-19 cases. Healthcare providers may not see potential coronavirus cases in person and only consult telephonically, which will likely result in self-quarantine and observation of symptoms. Now, the reason that they're doing this in South Africa is because they don't have the hospital beds. The public health system is a complete disgrace. Anyway, the letter continues. We will continue to enforce 2 weeks self-quarantine in the above cases when school reopens, and we highly recommend self-quarantine outside of the school setting while you wait for any diagnoses. Please also inform stepping stones of any illness, confirmed cases of contact with cases occur while we're on break, so we can update our plan to reopen school and communicate with other families accordingly. It is a very hard decision to close the school, and we understand how hard this will be for families. Again, the school will work with staff to send out activity ideas. We have also heard about families setting up a close group of families that practice strict isolation protocols, i.e. no restaurants, shops, gym, office, etc., to provide a safe space for children and parents to socialize. We will continue to keep the Stepping Stones community up to date, and again, we hope that the Stepping Stones community can stay positive and support families directly affected. Please get in touch with questions and we will answer them the best we can. But please note your doctor is now primary contact for specific health questions. Now, they're doing the right thing. But can you imagine in some of these African schools where, you know, the level of knowledge or understanding of the coronavirus is literally zero? So you have a young student whose mother might be a domestic at a house where someone's got the coronavirus. She catches, he gets a cough, passes it on to the kid. Next thing you know, the kids are running around the school, playing in the playground, sitting down in a classroom, coughing all over the place, and bang, 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 bang. You got a cluster. This is the sort of scenario, the nightmare scenario that is coming to South Africa. You've now got 38 cases. That's the tip of the iceberg, believe me. I listened to an audio tape that has been sent to me by several people. I'm not putting it up on the channel because it's unsubstantiated, but it's apparently a lady from South Africa who's living in Italy, and she's saying how that country has been devastated by the coronavirus, how many people are dying. I mean, we can see that from the number of infections in Italy. Thousands of people are now being infected. It's just out of control. Now, what this woman is stating in this audio clip, and again, I'm just putting it out there because this is what she's saying. She says there are already known to be 700 people in South Africa with the coronavirus, and the government are fudging the figures. Now, I'm just telling you what this audio tape says. It's unsubstantiated, but like so many things that I've said that have been unsubstantiated about this subject that have turned out to be absolutely on the money. I'm just letting you know, this is what I am hearing. All right, guys, please remember to subscribe to be kept confirmed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.